You'll see a picture of Anuben Thakkar here.
Yes.
Okay, wonderful. She's the one who started Muni Seva Ashram back in 1978. And you can see the story of how and why she started the ashram. Vikram Bhai joined soon after the ashram was started and has been single-mindedly dedicated to the mission since then. He took over from Anuben, I think, Vikram Bhai, please correct me, about 25 years ago, uh,
2001.
2001, after Puja Anuben passed away. Um, and it's really an amazing effort. I'm always, I think for me, equally as much as the ghee is enjoyable, I've enjoyed my interactions with him. And for that, for me, that's a reward in itself. Each time I visited the ashram has been memorable and enriching, just being with him and visiting the ashram. He has a refreshing way of looking at things, and hopefully you get a taste of it in this short interaction. Um, let's start with the video, and then we can continue from there. Let's hope this bandwidth is supportive.
Make volume.
We can't hear anything, Nakul. Your volume is off, so we can't hear. You have to unmute yourself. And the volume on the video is muted.
We can see but can't hear.
On your computer, is the volume up, Nakul? Or the video, sometimes a video you can hear because you might be playing it, but none of us can hear it. Vikram, but you may want to speak through the video to describe the video.
Oh, actually, there is no speech, only some music which reinforces the video. There's no voice actually.
So, well,
But
you can.
music will make it more.
Yes, well, maybe since you're here, you can maybe describe some of what we're seeing so
What is
that
written only
people
there.
have more.
So it is only titled everything.
Thanks. I'm I'm sorry about the sound. I'm not sure. We tested this out. It was working earlier. I'm not sure what happened, but as Vikram Bhai shared, it is just music. Um, so just to kick this off, I thought sorry, Vikram Bhai, were you saying something?
No,
Okay.
go ahead.
Let me kick this off by asking what was the initial impetus to starting the Gaushala at Muni Seva Ashram in light of everything else that was going on, and also to continue it with the way you are? What's the impetus, and what's the continuing motivation? How does it fit
See,
in?
at ashram, everything what is developed is need-based. So when we had schools and hospital and kids, we require dairy products, mainly milk, and which is main part of our diet in India. So we started with 2 cows initially to have milk for our children who were coming for the kindergarten. And as the demand rose, we kept on adding cows. And basically, it is to fulfill our own requirements. But when we met last, about 8 years back, and with your father, he suggested that you might export some ghee. So we added few more cows so that we can cater to your demand, basically. So what cows we keep here, it is to fulfill our own demand, institutional, because we have 2,200 mouth to feed every day. So we require enough dairy products also.
And is there was the selection of the breed, the Gir and Kankrej breed, was there a reason for that among
Basically, they are too indigenous, so they are well suited for our environment, one thing. And then the other breeds which were basically not native to India, and they were having a lot many other problems also. So their health problems and other things, and they're very even costly to maintain also. These cows are well suited here in this environment, in this heat, because in summer it can go up to 45 or 45 degrees Celsius also. And then later on we learned about 90s, the difference between A1 and A2 casein protein. And we were happy to learn that our choice is right one.
Right, validated afterwards. Right. That what you shared initially, that was something that stuck for me also from our early interactions. And this is a lesson. I think that it's a broader lesson that, and it's interesting how you approach it. That it's not been a plan-based ashram, in the sense you never sort of, it's always been a need-based response that you had, which is amazing, and working with the resources you have, and somehow the resources appear to fulfill the need that you're trying to fulfill. But there's no 5-year, 10-year plan like we're used to seeing in other business situations. It's never worked that way.
So if you allow for about 3-4 minutes, I'll just say genesis of ashram.
Yes, please.
So when Anuben came, she wanted to serve the local people as per her guru's request and order also. And she was basically a teacher. So she started with kindergarten. Now these kids needed milk, as I told. So we started with Gaushala. These kids also needed some medical help off and on. So she approached a medical school in Baroda, and we started coming on Sundays to run a only Sunday clinic to take care of minor ailments of the kids. And it slowly became a hospital. And till 94-5, it was a basically good hospital. But then we used to diagnose many patients with cancer. And as there was no facility, we used to refer them to Bombay Tata Memorial Hospital, which is the biggest one in India. And many patients will go to Anuben and request, why, how can we go all the way along in Mumbai and we will be lost there and the cost and everything. Why don't you have some facility here? And that's how we started thinking about the making a cancer unit, which was started in 2001. Same way when kids became 6-year-old, they require primary education. We started with primary school, and it took us up to secondary school and higher secondary school slowly. As we developed the hospital, we needed nurses. So we started with a school of nursing also. And after the school education, not everybody will go to university. Some might be fit for some vocational training and other things. So we started a vocational training center to take care of those who passed 12th or no and don't want to go to university for some reason. So this whole development is need-based and one taking to the another. As I told, we needed vegetables and fodder for our cows. And in the rural area in those days, we couldn't find any vegetable market. So we started growing our own, and then we started agriculture in that way. Now for food, yes, I mean, we are almost 90% self-sufficient. We grow our own cereal, pulses, vegetables, and most of the fruits also. So that's how we have developed without any plan that, yes, this is what we want to do. Yes, the need comes on from the society, and we keep on addressing them. And that's how we have developed so far.
Beautiful. It seems to be the most sustainable way to grow. I think this is a larger lesson for our world.
So our agriculture is also free from chemical, pesticides, and fertilizers since 1998, where we stopped using all other chemical fertilizers and pesticides. After knowing that, yeah, they are very dangerous for the soil health, apart from our own health. And we allowed the soil to enrich by itself. And now our production is almost as safe, good, or even sometimes better than other so-called modern agriculturists. So, and that has proved that, yes, we were on the right track.
What, Vikram bhai, how does MSA's Goshala operation differ from the typical industrial type of dairy?
You have seen it, so we don't use any other except some disease medication for cows sometimes. And cows also don't become so many times sick because they don't go and graze outside. We have our own grazing grounds. So they are not contaminated by any other disease pattern from outside. And we allow to suckle our calf till calf is satisfied, and then we milk the cows usually. So that way we are also getting our own needs met, also at the same time not depriving the calf from the mother's milk also, like that. And now in Gujarat, there are quite a few gaushalas which are doing this practice, let me tell you frankly. Yeah.
Yes, it's people are becoming more conscious as consumers and asking for more. Also, hand milking, I think that's another point of differentiation from the industrial operations. Vikram I'm not seeing, please, as Shweta has mentioned, folks, please feel free to ask questions you may have. This is, we have no, don't
Yeah, basically,
like you need to,
this could be a dialogue. So rather than a monologue or lecture,
right.
I would appreciate that if somebody has some problem, question in mind, and if I can address it.
Yeah, I have a question. I think it's absolutely incredible what you are doing, and over those relatively short period of time to have extended it to such a big operation, in all the different fields. My question would be like, how do you finance all this? How are you able to, because everything is totally state of the art, beautiful, clean. And how are you managing to fund all this?
Yeah. See, as I told you, on food side, we are self-sufficient almost. So we grow our own food. So there is no cost actually. There is a perceived cost, but not actual cost. Hospital operations, we used to meet with donations so far. But now government has come up with this so-called Ayushman Yojana, which is like some Medicare in America. So what we treat the poor patients, governments pays for it. So that has taken care of our expenses. And all our new development is donor base. We have personal donors. We have very few corporate, but most of 99% are for private donors like you and me. And when they come here, they see and then they want to help in one or other field. And that's how we get the donations also every year. Once a year, I also come to US and Canada, see all our well-wishers and friends and donors, explain them the new projects and report them about the last year's donation and everything. And then they continue the supporting us. And that's how our uh, donor base gets enlarged slowly over a period.
Dr. Vikram, I have a question. And so, I mean, the beauty of this is naturally everything as the need-based philosophy, it's natural, right? There was a naturally need for something and it manifested. And that's the beautiful principle of God, universe, anything that is aligned in service, since Muni Seva's principle is service. And it's such a beautiful example of how effortlessly, it seems like. Not that hard work isn't, and your conviction is huge, and your team members and all the sevaks. I'm just curious, as the world rapidly evolves, it's changing so quickly. What kind of challenges, if any, are you, or, what is your perception of how things are unfolding in this Kali Yuga right now? And you just mentioned there's some new projects happening. I'm assuming that's also need-based. Can you speak a little bit more about, quote unquote, these challenges or needs and how Muni Seva Ashram is addressing that?
Yeah, so the need keep on coming. We will at whether it is appropriate for a routine, our what we call Indian cultural living or not. And if it is so, we try to address it. We always tell the people that is appropriate technology use and sufficient. Because what is sufficient may differ, but at some point you have to decide that, yeah, this is sufficient. Because otherwise there's no end to our needs and greeds. So that is also we try to teach in our schools. And that's how we are also living that, yes, what is just needed for our own basic living and not going very exorbitant type of living or requirements that you have to have this or this. And we also want to contain the growth to some limit, basically. There are so many new things coming up, but not everything is appropriate. So there are good things, no doubt, but still, I think that it is not needed for our type of living and institute. So we just, okay, we say it's good thing, but we are not for that. And usually for the basic four things that we are doing at present, education, healthcare, social support, and energy and environment. Okay. So there we want to make it self-sufficient and zero waste system. So waste generated by one of our system becomes the raw material for the next system. And that's how we have almost everything we reuse or recycle. There's nothing is wasted here. So and that's how we can maintain it basically. But tomorrow, I don't know. Because so many new things that people are fascinated by, like AI and some other things. It has some role somewhere, but for a simple living, I don't think. Because here we are stress free basically. We don't have any stress of this thing or that thing. Because we have not to compete with anybody. We don't want to go anywhere. Okay. We are happy here. Our life is fine. And what God gives us, we just consume it and live peacefully here.
Vikram bhai, you shared in the past, and you've been quoted saying, "Our real need is joy,"
Yeah.
and
At the end of the
that
day,
has really resonated and stuck for me from my interactions.
yeah, it may differ from where you want to have your joy. For one person, it may be just a simple sunset. Or for one person, it may be a 7-star hotel. Depends. So you choose your joy where it lies, and then accordingly you want to live your life.
I have a question. Sorry.
Please.
So have you ever been approached by anybody to replicate this entire model in another situation? I mean, are you documenting everything? Are you putting it like, because it took almost 100 years for Harvard to do a course on, to do a lecture on the Dabbawalas of Bombay, for instance, with their Six Sigma approach, right? So has anybody ever approached you to sort of replicate this thing in some other location, or is that not something you think about at all?
Not as a whole. In bits and bits, yes, people are approaching. For example, some people, when they want to start some cancer hospital, they approach us. Somebody, when they start for organic farming or gaushala, they approach us like that. But I think difference is that they wanted to make that thing. We never wanted to make anything. It has developed. You see, cancer hospital we never wanted, but it was demand from the local society, and they wanted it very much. It was a geographical need here. Okay, there was nothing nearby, so we had to develop it.
Yeah.
Like, so there's some difference in that, and nobody has approached in that way like that.
Yeah, it's just that sometimes people don't have the time to reinvent a wheel, you know. So they have the idea, they have the finances, they have the wherewithal, but they cannot replicate. So I suppose they can approach you at any time.
Yeah, I mean, we are always open because we are in a social organization, open for society, run by society, and for society. So anybody that we have learned, and if it is worthy for somebody and help somebody, we are always open. What we can do is we can share our experience and our 40 years, what we have and what we have taken decisions somewhere or wrong ones. So we can share those all things with anybody who wants it. That way we have helped many cancer hospitals in Gujarat to come up that what should they do and what should they not do, like that. On agricultural part also we are doing that thing mainly.
Thanks, Chitra.
It's really an amazing model. You really feel like, because you feel like if you go back to the Gurukul system of education, and
Almost.
this is almost like that. It's like you're living the life that you aspire to, and that is the most important, because in America or anywhere in the world, actually, even in Bombay or any of the urban societies, there's a very big disconnect between what you are educated in and what you end up living your life in. There's a huge disconnect between the two. So
Yeah.
in this, it's so beautiful to listen to your story and to see the video, despite the sound not being there, but it's really beautiful. Um, I was talking to somebody at Tata Memorial, and they are now expanding rapidly to various remote locations,
Yeah.
including Assam and those northeastern states which I've never even heard of cancer
Yeah.
care actually. They used to come all the way from Mizoram and Assam and Jharkhand to Mumbai and
Mumbai.
live
Yeah.
on the streets actually. And and I was just thinking, there are so many models. Like, why isn't somebody taking it to them instead of them coming to the thing? And
Mm.
today to hear this, it's so heartwarming, to know that a next trip to
On
India, I'll come and visit you.
on that point, we are really indebted to Tata Memorial Hospital, Mumbai,
Yes.
because when we wanted to start this because of the need, I must have spent about 200 hours with Tata professors to understand the nativity of cancer, technology of cancer, and everything. And they were so kind and so helpful. Okay.
I'm happy to
I am
hear
talking about 97, 8, 9 in those days.
that. Yeah,
Okay. They always guided me rightfully.
Tata is an amazing, amazing institution. Amazing. Yeah. And the people who are there are genuinely interested in.
Yeah.
So I have one more question. I'm sorry if I'm taking up all the question time, but um, so Maha Ghee, or the ghee that you're producing, um, um, I've been told like ghee is actually I'm always confused, whether fat is good for you or not good for you. So can you talk a little bit about the ghee itself, which we are like consuming over here?
So there are two different schools, Ayurveda and allopathy, like that. As far as Ayurveda is concerned, cow ghee is most reputed food in Indian culture. Okay. And we make with typical old fashioned, like in the evening, whatever is leftover milk is there, we cuddle it, let it be curd overnight. Next day morning, with Valona, we do it, churning, take out the butter, and the buttermilk is either distributed to the surrounding villagers or consumed by us also. And then butter is made into ghee by heating on the pan and other thing. Like, so typically, what is that? And leftover milk is only consumed for that. And as there was need by Nakul, we added few more cows so that we can have some more milk to support the program like that. Okay. Otherwise, we used to make our own requirement. That's it. So it is a traditional method that was used about 200, 500 years back. And we have found it okay. That's,
So it's actually very exclusive. You cannot scale the ghee model. You cannot
yeah.
produce. You cannot
No,
scale the ghee part
no.
of it.
Tomorrow,
Right.
Nakul says me every year, a month, I want 1 ton. I'll say sorry, Nakul. We
Yeah.
can't.
Yeah.
We can't.
No, I mean, not that I have any method of buying 1 ton, but I'm just thinking, like, if we were to propagate it and tell more and more people about it, but
Yeah.
then it's not available. Like in the past 2 months, I've sent out emails, but Maha Ghee is not available because they've run out of stock, So I was just curious to know about the scale part of it. Anyway, I'm I'm not going to take up any more time, but thank you very much, Dr. Vikram, for being on this call. It's so inspiring to listen to you and know about all this. Thank you.
Vikram bhai, I have a question.
Yeah,
Many of our
please.
participants today are from the world of Ayurveda. How does that play? Uh, how does that play a role in the Muni Seva Ashram scheme of things? How does that fit in? And where do you see its value?
Who is from Ayurveda?
Yes, please. Yes, please.
Question is to me or some Ayurvedic
No,
consultant?
to you actually. How do you see Ayurveda playing a role currently and going forward? Since you run the cancer hospital, you have a cancer
See,
hospital there, you
yeah.
have.
Unfortunately, I am also trained in a modern medicine rather than Ayurveda, which I would have loved. But in those days, I never knew that. But in Ayurveda, what little I have read and learned from my friends, uh, the Panchgavya, what they call, is very useful for the health of the human being. I mean, what is the milk, curd, buttermilk, butter, and ghee. So these five things they are not harmful to the body, but in a appropriate amount, they are good and beneficial for the uh, human life. And especially this A2 and ghee cow, because there's a lot of beta carotene in the milk. And that's why if you see the ghee cow milk, it will be yellowish, not white, pure white, because of the lot of beta carotene in it. And so beta carotene is a precursor for vitamin A, especially, which is a fat soluble vitamin and very required for our eyesight and other things, including skin health also. And so, not a scholar of Ayurveda, but those who are friends of Ayurveda, they tell me, Vikram, you have to consume about 10 to 20 gram of ghee every day, and it is good for your health. Today is what joint problem people suffer from. It is because of lack of ghee rather than anything else. That's what they believe.
Mhm.
Okay. And
That-
I wouldn't say anything, but I am consuming and I don't have any joint problems so far. Whether they are related or not, I can't say.
Right. Of course, it also speaks to your digestion or our digestion too. Um,
So,
that matters too in that respect. But my question was a larger one about whether you see Ayurveda playing a role, increasing role in terms of the ashram's activities and especially cancer care potentially. I mean,
in future, we want to have a comprehensive cancer care center future. But still, today, neither people nor the medical profession is ready for that, let me tell you. And unless the people are not ready, don't try to push something which will not be accepted. And you will feel that you have failed unnecessarily. Okay. One more thing, what Ayurveda tells. Ayurveda doesn't believe in the reliance of anything. Like you supply whole of the world like that from one point. Says what is grown within, let's say, 30 kilometers of your residence. Consume that. What is grown, that is your food also, that is your medicine also, and that is your environment also. You should not eat imported fruits. What grows in your area, eat it, and you will never fall sick. Basically, Ayurveda is the science of health rather than sickness. It is Ayurveda. Okay. So it teaches you not to fall sick. Once you are sick, then there are some medicines. But if you follow the Ayurvedic practice properly, I don't think one should fall sick that way. That is the basic concept of Ayurveda.
well articulated, Vikram bhai. And that's in a way been a conundrum from the start of this program. And about importing this ghee versus this wonderful ghee, which versus what's available over here. And that's in a way sort of restricted its supply also. it's medicine. I mean, as I saw it, it was cow medicine from the cows, medicine from the cows of Goraj and Muni Seva Ashram. Ergo, the quantities are limited, and it's only a need-based consumption that we would like to see happen. So it's not going to be on every shelf or on Amazon, etc., for that very reason.
And multiple institutes or farmers should produce it to supply for the local needs wherever it is, rather than one institute growing big and then supplying, let's say, 5 million people or something. That's not the way.
That would be un-Ayurvedic, actually.
Yeah, it is. I agree.
Vikram, I know you shared this with me, but my Gujarati isn't as at your levels. What does Goraj translate to? Goraj is the village where Muni Seva Ashram was started
Yeah.
and continues to
Goraj is
grow.
when, see, in ancient times, cows will go to grazing in the outskirts of the village. And when in the evening they come back because of they are running sometimes because they want to go home. There where calves are waiting or something like that. So lot of dust is raised, and that is dust is raj, and go means cow. So the dust created by the cows walking is the goraj. So in ancient time in Goraj there were a lot many cows here, and that's why the name Goraj was coined at that time. And this is what it is, Goraj, and also it is known as a time also. Goraj means evening time. When somebody says Gorat Tanu Thayu, if somebody knows Gujarati, Gorat Tanu, it is evening time where the cows come home back.
Girish Karnad actually made a beautiful movie called
Manthan.
Goduli. No,
Goduli, yeah. That was
Goduli.
on
Different subject, but
subject.
the time of
But yes,
the evening
yeah,
time when the cows come back and the
yeah,
dust rises.
yeah, it does. That is the Goraj.
Yeah.
Anyone have anything to share or any questions? We still have a few minutes.
I'm just very grateful for this beautiful production of the ghee, and Nakul, that you bring it that you bring it to us here to the US. And every time I open a new tin, it's like, oh my God, it's just so good. And I just love this ghee so much to cook with it. And yeah, I really do. Thank you.
I'm really doing nothing in this process. I'm really just sharing, couriering, and honestly, this started with me wanting it for us here and just needed more participants. Otherwise, it would not have been viable. There's no courier who's going to bring ghee over by plane. This liquid product from there. It needed a shipment by sea. Purely selfish motive started it. But really, it's now evolved, and these knowledge circles that Shweta has co-conspired to make happen is really also a very fulfilling part of this. And I think ghee is uniquely suited to share, to sort of signify and symbolize knowledge and essence. And that's what this project has also, I mean, just evolved into. It's much more than the physical ghee. But then we need a suitable ghee to actually match that. And there's not going to be an alternative to Muni Seva Ashram for Maha Ghee. It's just I wouldn't have conviction in it. I have a couple of slides to share, but meanwhile, if anyone has a question, please do ask.
It's all this like need-based necessity and not over consumerism kind of way of living. It's also kind of in alignment with how Maha Ghee we've shifted it as those who are on the call who are ambassadors is right. We're asking what is your need, And so before it was less kind of like we would just order it and then, people put their orders in. Now it's the opposite. It's like, what do you need? And then we're putting the order in. And so it's less waste as well, in that way. And same with the knowledge circles. As an Ayurvedic practitioner, saw a great need of people's depth and their understanding of the essence of ghee, the uses of ghee, was very, very shallow. And even within the Ayurvedic community and practitioners, it was very kind of like the whole turmeric thing, where something is good, it's overconsumed. And that's not necessarily the right approach. And so, again, the need kind of was like, oh my God, there's so much education to be needed. So then we bring in all these amazing Vedas and other philosophers and teachers and mentors to come educate on the various aspects of ghee, not just medicinal or clinical. And so the need here is the focus, the principle of, I guess, need-based around sustainability kind of pervades in all aspects, not with, even though Maha Ghee is like a little bit of a appendage of Muni Seva Ashram. And also a lot of what everybody here is a user, I think majority of the people. And so your resources, your funds are also supporting Muni Seva Ashram as well, because we are buying it from them, right? So that's kind of covering their costs and their projects, and so it's kind of like a circulatory thing. Of course, we have to pay for our custom costs and things, but otherwise, a lot of it just goes to Muni Seva Ashram. And I think somebody was speaking in the I didn't catch who that was. Feel free to unmute yourself.
Hi, my name is Namitha.
I know it.
Hi. So I had two questions. One was, the role of the Maha Ghee when it comes to cancer rehabilitation. Is there, just what is the view on that? And second, of course, is to figure out how to get Maha Ghee. I live in New Delhi. Hello?
Hi, Nomita.
Hi.
It's not the brand Maha Ghee is not Muni Seva's ghee is available in the US as Maha Ghee. In India, it's not available as Maha Ghee yet. We just, as Vikram Bhai shared, there's just not the production capacity for it. It is available in small quantities at the ashram itself to purchase, and then for folks who can make a bigger order, then the ashram can supply them directly from there, within India, that is. There is a logistical issue with the local courier services and all of that. We are able to take care of that when we import the lot in the US, but within India, it's typically personally picked up at the ashram. That's how it is. But to your question about how whether ghee has a role to play in cancer care, I think that maybe Vikram Bhai has a view on that that he could share, please.
No, I mean, on cancer care, except some energy and immunity booster, not much that I know about that. And but people consume it, and some way, I mean, Ayurveda Acharyas, they suggest also. With what intent, I don't know.
Okay,
Hello,
thank you.
everyone. This is Sogna. I'm in the US in Michigan. Hi, Shweta. Nakul, good to see you. Sorry to join so late. I'm gardening. But and I'm sorry to miss this call because Nakul and Shweta, you know how important this is to me, that Shweta sent ghee to me 7 years ago when my daughter had leukemia. And it was within the week that Shweta sent me this ghee and we started using it with a protocol that she shared with me. The chemotherapy wasn't working. My daughter was 9. And within 1 week of using Maha Ghee specifically, Wyana's cancer was gone. So she sent it to me on a Saturday, and the following Friday, there was no leukemia that could be found, no cells. And now we're 7 years past that. And this past October 2023 was Wyana's her final checkup. She's just normal. Everything is clear. I want to tell you, I think that there's some research to be done in Wyana's folder that they gave us that has all of her care, every microgram of anything she took in her body. They put Maha Ghee in there because I'm a clinical herbalist, and they have all of the herbs we use, all of the protocols, all the teas, everything I was giving her. And her doctor was very interested that ghee was a part of it. And so it's actually listed in the things that her mother gave her. So there's all the medicines and all the chemo. And then there's a whole section about what Sokna I gave her, and Maha Ghee is in it. So I just love that I happen to be able to slip in for the last 30 minutes here and share that with you. But I do believe that there is a possibility and need for the research. And here at Bronson Hospital in Michigan, it's listed in somebody's privacy of their medical records. So that's what happened. My daughter is 16 years old now, healthy. And this was a part of her. And we use it every day.
Happy to learn about.
Yes. So thank you. Thank you for everything.
Yeah, there's amazing.
Great.
There's those of you who've been with us, one of our first presenters, Dr. Ram Manohar, he's in Kerala with Amrita, with Amma's schools and hospitals. So there's a lot of research happening through Amma's kind of efforts and projects, and he's leading a lot of that. And so there's a lot within the Ayurveda community that I'm involved in. And so, I mean, in a nutshell, it's about kind of, again, boosting your Agni, your transformation energy, to transform the quote unquote negativity or things that are not functioning properly, and empowering the cells. That's the natural intelligence in our of who we are, our soul, the soul of the cells, etc., to really reignite its already intelligence so that it can be more empowered, so that that immunity can build to kind of defeat almost the quote unquote cancer cells. And so it's kind of like a little Mahabharat within our body, and ghee plays a huge role in that. So of course, every case is unique, and it should be used judiciously, absolutely. And so that's why it's really important to work with an Ayurvedic doctor, especially with cancer.
Great.
Vikram, I had one question for you. Last question, if someone else doesn't have. What can we learn from the cows of Goraj and from the Goshala? And I have a slide to share in that regard.
So the slide then?
Yes. Where is one moment. Share. One moment. You see this?
Mm. Yeah.
what can we can we learn? I think once you had shared with me in walking through the fields and the Goshala that cows only eat what they go for what they need when they
Yeah.
want to graze. You had shared that with me for the first time.
Yeah. When they are naturally grazing cows, not stable fed 100%, then they will find out what is needed by their body, and only that thing, if available, that is another thing. They will take it only. And we have not reached up to that extent yet, let me tell you, because our 60% time they are grazing, but 40% they are stable fed also. And that then we put what we wanted them to eat rather than they wanting to eat like that. Yeah. So, but yeah, that is a very typical of cows that I think most of animals also but cows I have seen, they will eat only what is needed by them. And that's why their free grazing cow milk is always best.
Thank you.
Yeah.
Shweta, did you want to just share what's coming up next? So thank you all for participating. We won't take up more of your time and Vikram Bhai's time. It's late in India.
Okay.
But we have a circle coming up in September. I'll let Shweta share a little bit more about that.
Dr. Vikram Bhai, did you have any closing comments and things? I know it's late for you. So before we dive in to all the other kind of announcement stuff, did you have any closing words for us or anything, words of inspiration, ways of living that, you know, kind of captured the essence of the ashram and kind of what feeds you day to day?
See, by telling, I don't, my personal view, by telling somebody to do something, he or she may not do it. But if it is from within, then people will follow it or try to live. So there should be something from within that, yes, this is what my life is like. Then you pursue that one, and always listen to the inner sound. That's what I always feel, and that's what I have also done all my life.
Yeah, wonderful. Thank you so much. Once again, thank you so much for taking precious time out of a busy schedule to join us today. Thank you so much.
Okay, Nakul. Bye, everybody.
Thank
Jai
you,
Shri
Vikram
Krishna.
Bhai.
Pranam.
Jai Shri Krishna.
Yeah. So on that silent note of Mu or Om, a nice sliding closing scale.
Oh,
Thank you,
okay.
Dr.
Okay, pranam everybody.
प्रणाम पंखो કરી દો વિક્રમભાઈ
Huh?
पंखो ચાલુ કરી દો આખા સેશનમાં पंखो આવતા અઠવાડિયે આવું છે આશ્રમ 4-5 વડીલોને લઈને નવા ગામના તો આવીશું એટલે મુલાકાત કરીશ થેન્ક યુ થેન્ક યુ
Sure. Okay, bye.
Great. So a couple of upcoming announcements. If you are needing Maha Ghee, yes, our site is sold out, but we have individuals who have some stock still. So just reach out to info@mahaghee if you're in need of any ghee, or my email directly, nyc@ayurdula@gmail.com, which is in the chat box, and we'll hook you up. And if you are an ambassador or affiliate and we will be placing our next order soon. So if you haven't already expressed, if you need 1 case, 2 cases of the 32 ounce or the 16 ounce, then please let us know as soon as possible. Number 3, our next circle is going to be in September now. which is with Dr. Ramdas, who is part of the Vedic-Grama team, who's one of my Ayurvedic doctors through some panchakarmas that I've done throughout my Ayurvedic journey. And he's going to be talking about Sukham about inner happiness or creating this spaciousness. And what does ghee have to do with this? Of creating that quote-unquote space within. So the link is in the chat box, and the link is ready for registration. So it'll be actually September 15th, I believe. It's a Sunday around just the same timing. East Coast, Pacific, Sunday mornings, and then India time, it is in the nighttime. So yeah, so stay tuned. You could, the newsletter will have it, and stay tuned to the social media as well but at least the link is ready for registration. So feel free to click on it and register now. And we'll have the next one in September.
One quick question, Sweta. A case is always 12, right? I just had somebody text me they would like to place an order of 6. So I can do 12 and then, forward maybe that other 6 to her. Because you don't ship 6, right? It's always like 12, right?
Right.
12
and
is
if somebody else in different ways. And if that person, to a new person and get the other 6, then, that's even better where, more people get to benefit from the ghee or be exposed to it. But yeah, right now we're just focused on cases.
awesome.
But then, if there's other suggestions, feel free to just email us, and that you can just reach out to Nicole, and if there's any denominations or something like that of 1632 or whatever, I'm sure we can figure something out. Okay, well, thank you all for joining. And any other questions? If there's any other topics or other people have other requests for these circles, please do not hesitate to let us know. We kind of, as naturally some topics and things arise, that's kind of also how these circles have been going. But if there's a yearning desire for, even like something like cancer came up in today's conversation, if that's something people want to learn more about or educate themselves about. Sadly, cancer is growing in our world due to our lifestyles and a lot of other factors. But the point being is that if there's something that a topic that you'd like to know, and we'll do our best to kind of make it happen. And even if you have suggestions of different teachers or presenters, right? Just suggest them and feel free to even make it happen and coordinate it. So this is, again, these circles are there to really be in an expansive way, understand the essence of ghee and its completely multidimensional medicinal properties and benefits that our mind can't even fathom. Okay, any other closing comments, Nakul or anyone else? And then we can call it a day.
Thank you, everyone, for making the time and joining us to make this conversation happen.
Great. I had a few more photos. I don't know if people want to see what some of the photos that Vikram Bhai was talking about. This is from our trip from Muni Seva Ashram. I don't know, how long ago was it?
2016.
Yeah. And so I'll just quickly flip through them just because we're here, and I think it might be interesting for folks.
Yeah, why don't you have another trip? Let's all go. You know, I'll go. I'm ready. I just got back from India. I'm ready to go back.
So this is, yeah, that would be super. If we have a good contingent, they're always welcoming for sure. This is Bikabai, who's one of the chief cow herders at the Goshalas. And he gave us nice, beautiful explanations of the ways of life or the way the cows are living. Can you hear me?
Yes, I can hear you. I can hear you.
That
was Shweta there, and that's that's us taking a life lesson from the cow herd, who shared who was sharing how he's never had any need for medicine actually, because the cows were looking after him.
nice, yeah. Mm. This is part of some of the photos that are involved in the ghee making process. So this is before it gets all tinned into the can at the very end. Sorry, there's not a synchronistic thing here, but here is a beautiful slide of kind of the flow of the ghee making process. We do, it's this just to be transparent at Muni Seva Ashram, we say it's traditionally made, but it's not Bilona ghee. It's not hand churned just because of the volume that, you know, the amount of ghee that is used by the cancer hospital and all the other projects. And so when you see the centrifugal separation, and there are there is electricity used, some machines. I think there are a few more, but having some tech issues. But anyway, just a little quick glimpse. We have more photos on the website, I believe. But hope everybody enjoyed it. Thank you for joining us today.
Thanks, Shweta. Thanks, everyone. Have a great day.
Hey, good night. Good day.